on health care, the other big issue that you face, Medicare for everyone is now the sort of catchphrase. Do you think that you can sell this? You said to the caucus the other night, you think you have 200 votes or more, you need 218. Are you going to be able to cross the finish line with a strong, robust public option, whether you call it Medicare for everyone or something else?
Well, everyone has their little catchphrases. Public option does not reign as the great choice of words, but it does have an appeal with the American people, and that's why over 60% of them support having a true competitor to the insurance industry. They know full well that there needs to be something to keep the insurance companies honest and to have true competition, whatever you call it.
Are you going to end up calling it Medicare for everyone?
No, I don't think so. I mean, we will have a strong, obviously a strong component for Medicare. We strengthen Medicare, we sustain it for years longer, and we start to close the donut hole for seniors. That's part of Medicare. So Medicare is an important part of the legislation, but it isn't a question of what it is named. It's a question of what the bill will do.
And it will have a public option.
It will have a public option.
Doesn't that mean
we would always have the votes for the public option. It's just a question of what form it will take. And the form is largely related to the fiscal realities of the legislation. What does it mean to the budget? We must pay for the bill, of course, but we also must reduce cost and not add one dime to the deficit.
Would it be something, could it be something acceptable to you that would have an opt-out or something else that would make it more in line with what the Senate is likely to produce? Because you're asking a lot of moderate Democrats to walk the plank on a House vote for something that may never see the light of day. That's a big, gut-wrenching vote for them.
I understand that full well.
Better than I do.
But no, you've been around Congress, so you know that you don't want members to take any unnecessary political risk. But this is what they believe in. It is any option is a good one. You know, so it's not a question of one being superior to the other. It's just which one saves the most money, which one is the most fiscally sound, and which one will work best. So we have to weigh these, and as you're so right, again, with having covered Congress, you know that to the extent that we can resolve as many of our differences earlier on with the Senate, that would indicate more success at the end of the road. We will have a public option. It will be very effective. It will reduce cost. It will improve quality. It will meet our three standards, which are affordability for the middle class, security for the seniors, and responsibility to our children, by not only making them healthier, but in not adding one dime to the deficit.